Welcome. Thanks for joining our Research Info series, A Blind Date with Knowledge. I'm your host, Laura Brady. Today, I'm joined by Dr. David Austin, who will talk to us about the cardiology involvement in research. Okay, Dr. Austin, thank you for having a discussion with me.
Okay, pleasure.
Can you just give a picture of your involvement currently with the research department and how it kind of what it means for you in your workload as a consultant?
So part of my job, I'm a full-time NHS consultant, but a significant proportion of my work involves clinical trials, and I'm cardiovascular lead for James Cook. Mm-hmm. So in terms of my daily activities, usually I'm doing something almost every day, research related, whether it's related to reviewing a new protocol for a study, recruiting patients into our clinical trials, or writing protocols, applying for funding, or attending meetings. So I would say it forms a very significant component of my week. Yeah,
in a very varied way. There's a lot of different things going on there.
Yes, yeah. There's an awful lot to research once you start to sort of delve into it. Lots of aspects, including some organisational and planning and governance, making sure things are done correctly, as well as the sort of nuts and bolts of running studies. So most of it, I'd say that encompasses most of it, and actually the kind of thinking of projects and thinking of special ideas, that's probably takes up a relatively small amount of time in actual fact, but it's obviously a really important part of the process. Yeah,
so when do those ideas come to you normally because of your involvement with patients? Is that like a situational inception? And what does it take from that point then to set up a study and the design?
Yeah, so I would say for some people are better than me at having ideas. I don't have all the ideas, but so if there's a gap in an area, in a clinical area, let's say, we might come on to talk about PROACT a little bit later on. So maybe if I could give that as an example.
Yeah.
PROACT's a clinical trial we're running across cardiology and oncology and haematology.
Yeah.
We're looking
a big collaboration. Yeah.
Correct. So it's a study where we're looking to see if a simple intervention, an ACE inhibitor, which is a standard drug used for blood pressure and other heart conditions, can prevent the toxicity associated with some chemotherapy. The reason that we ended up with that as a study kind of idea was that we'd had a meeting, our academic meeting, where we discussed the issue and we'd gone through the data and we realised that the clinical trials in the area weren't really answering the question.
Yeah, it highlighted a gap there that you could fill.
Yeah, exactly. So I wouldn't have said necessarily it was my idea. It's been done in other places, but I think it's important to identify the gap, but also how you can then take that forward. That's to do with research design and making a case that the trial needs to be performed. That case needs to be strong because you need to get finance to do these things, and often you've had this great idea, 100 other people have had good ideas as well and are competing for the same pot of money essentially. So you need to make the case quite strongly for how you should perform the research, how you should perform the research. So I hope that answers that question in that example. But yes, having ideas is important, but kind of picking the right ones and articulating it and making sure it can happen in practice, that's really that's where a lot of the time and thought goes in.
I think as well with your extensive involvement, you'll be able to see those gaps. It's not necessarily that trying to find ideas. There's a lot of things that crop up, but like you said, it's to do with translating the feasibility and whether it can be conducted here.
Yes.
Do you think that will change in the future with the ACU plans? And would you mind just letting people know what that is?
Yeah. So the ACU stands for the Academic Cardiovascular Unit. So in Teesside, in this area, we haven't really had this sort of thing before. So if you go to big university towns, they're full of this sort of thing. We felt, and myself and my colleague Mr. Akua, who's one of the cardiac surgeons here, felt that there was a gap that we could fill by forming this academic cardiovascular unit. And the aim is to bring together people of lots of different expertise and experience. I think it's very important for me to say that it's not a one-man band.
Yeah.
Research is very much a team effort.
And very diverse roles to be undertaken within that, right?
Absolutely. So within the ACU, we hope to bring in people who have experts in research methodology. So they're often not clinicians. They have separate expertise.
Like a strategic point of view, like sort of systematic review, conduct and things like this.
So that's certainly part of it. So if you're building a case for a trial, systematic reviews can be important in highlighting what's out there already, where the gaps are, etc. So yes, research methodology, how you're going to perform a study, for example, what method you might use, what are the statistical considerations, how many patients you might need to study, for example, ethical considerations involving patients and the public in the design of the research. So there's lots of factors that need to go into thinking about and conducting a clinical trial or a study of any description. So we don't have that expertise, or we've struggled a little bit for that expertise, I would say, in this area. We tend to go to the bigger universities, so in Newcastle, for example, or elsewhere, York as well, looking for people with the expertise. So I think what we're looking to do with the ACU is to have a core team here so that we can work on projects locally. Now, we still will require the use of clinical trials units, but it will allow us to do perhaps more of the preliminary work for projects. So turning ideas that I've had, but not just me, but colleagues as well, into sort of definitive research, and to do that to a high standard. And that's really what we're hoping to achieve.
Yeah, I think in having that dedicated unit for it will be so beneficial. It's really exciting to hear that, actually, because you do need the balance of the clinical and academic side, right?
Yeah, absolutely.
How does, can you, just to digest that a little bit, how does that, what does that mean in terms of how the teams all work together and how those roles feed into each other? Okay,
so that's a good question, and it's currently under lots of discussion because the ACU is in its infancy, really. It's only a matter of weeks old.
Yeah.
So I think what we're already seeing is that I'm working much closer with my clinical colleague in surgery, Mr. Kuh.
Yeah.
We're also working closely with our new appointment of our principal research manager, setting up our sort of processes. And she has a lot of experience in conducting international clinical research. We're very lucky to have her sort of setting up the unit from scratch.
So it's about like how the different roles and who they're undertaken by, how do they communicate and ensure that everything kind of runs smoothly?
We'll have that core non-clinical team. We'll have a head of the academic unit who's not going to be clinical. And then it's a question about how we integrate with other parts of the hospital that are also important for conducting research. So we're sitting in the R&D department, so the R&D department are clearly critical to all of this. We can't do what we're doing without great cooperation with our colleagues in R&D. You're in the sort of support services side of things in laboratories, so that's part of what we do in terms of integrating with our clinical trials. With our clinical trials, we can maybe talk about that a bit more, but the final part of the jigsaw is the delivery team. So we already have the cardiovascular delivery team, which is up to now has been how we have conducted all of our research via our cardiovascular delivery team. So that's lead nursing. We've got a number of very experienced research nurses, and it allows us to conduct research at a very high standard. And when you're conducting research at high standard, then people come to you to ask you to do their research, and we've got a lot of experience over many years of doing that.
There's definitely with research, it is definitely the shoulders of many people before, you know. It's like building the foundations always for the future.
Absolutely. It's not a quick process, and you know, you got to think about the long term as well, and that's really where the ACU comes in. We're thinking about the medium term and the longer term, and making sure we embed high quality research, both in terms of research delivery, but with the ACU more of our own projects for the medium and the longer term. Yeah, it's exciting, and especially with regard to the wider clinical research network, you'll be able to feed into that probably a bit more as well. Because one of the guests on the podcast will be from the National Horizons Centre to talk about the stuff that they're doing there.
I think like as a network, it can be really strong with having lots of different pockets like this.
No, that's absolutely right. And in fact, we have visited the National Horizon Centre fairly recently. That's Teesside University, of course, and absolutely, I think it's an exciting project, isn't it? It's quite an impressive facility, and the level of expertise that we'll be able to draw on as clinicians will be vast. And I think that's only going to grow as time goes on. So I should say that our ACU is affiliated with Newcastle University, so we kind of have links with Newcastle University. But we should not close our eyes to certainly to collaboration, and that collaboration is with other universities locally. So Teesside is the obvious example with the National Horizon Centre, and I can see us doing projects with them going forward. And also if we look sort of south as well, there's other universities locally, Hull, York, and also Leeds as well, who we can collaborate with. So
exactly, when you have a well-oiled collaboration, it can go any direction.
You get the expertise that you require, and the Northeast in general. I think we can punch sort of above our weight, or we can do more by collaborating. Some of my projects already involve quite a lot of collaboration across different hospitals and across different units.
Yeah, exactly. So just bringing it back to that collaboration across like departments and specialities, and we'd like to talk a little bit about the trial PROACT, and kind of we can go into a bit about the design and what led to the trial setup.
Yeah, so we talked about that a little bit earlier in terms of how we got the idea together. My colleague Chris Plummer, who has an interest in cardio-oncology, which is a subspecialty looking at the impact of cancer on the heart, whether it's cancer treatments or cancer itself. And he has an interest in that already. So I teamed up with him, and we went to the clinical trials unit in Newcastle. Well, it was actually Durham at the time, subsequently become Newcastle, with the idea for the study. We then wrote the application and then eventually got funding through the NIHR to do the project. The project I mentioned earlier has a medication that we give to see if we can prevent the cardiotoxicity occurring, and the outcomes for the trial. So how do we know whether this is working or not? Well, we look at a blood test, a simple blood test called troponin, which we use very frequently in cardiology, and it's linked to higher rates of cardiotoxicity in patients who are undergoing chemotherapy. So there you go. There's immediately a interaction with the biochemistry side of things. So the blood sampling in PROACT is totally essential, really, to the study. Now, because we've gone with troponin T as the main endpoint for the study, we have a core laboratory in Newcastle who are analysing the blood samples for PROACT.
Those are the research samples. Because you have all the safety bloods in the baseline when a trial's involved with an investigational medicinal product. There's a higher quantity of samples that's required. So that's how I feel like I know you, even though we just met today, because I've seen your name on so many different samples that are processed in a range of different trials. But how many of the cardio trials are with a medicinal product in, and how is that?
That's a good question. So not all of them. So at the moment, so PROACT kind of we would regard that as a kind of oncology hematology project, even though I'm running it. So we've also got studies like TACTIC, which we performed recently. That may be in just after your time, possibly.
No, I remember.
Yeah. Okay, so TACTIC is completed. That was another CTIMP study, so investigational medicinal product. A lot of blood sampling involved in that, both locally and at the Centre for Life in Newcastle. Fractal, we're about to start, which is another major collaboration looking at a new medication to see if it can reduce the size of patients' heart attacks and the biggest kinds of heart attacks. There's an awful lot of blood sampling for that, as you know, because it's an early phase study. We've also got a number of commercial trials in setup at the moment, which will involve quite a lot of blood sampling. So we have a number of CTIMP trials ongoing. Not all of our studies are CTIMPs, however. For example, Mr. Akua, my colleague in cardiac surgery, has a major national project looking at different surgical techniques. Okay, so for that sort of project, for that sort of study, obviously you're not studying a different medication, you're studying different ways of doing surgery. And in those circumstances, we don't necessarily need the same blood sampling, for example. So it depends
slightly
on
different regulations and legislation that encompasses the device and technique side of trials.
That's right. So if you've got a new medication, early phase study, you will need to do a lot more safety monitoring, and in PROACT's case, it's the endpoint of the study, so it's really vital.
Amazing. What does this mean for the patients in terms of the sampling and the safety blood? Because that's sometimes, we'll think a lot about the protocol, the conduct and the setup of trials, but how does that information that you find throughout the trials translate for the patients that you're treating?
So first of all, patients who go into trials need to go in fully informed of what's actually involved. We're very blessed in this area, really, that patients are readily, are very happy to go into our studies, and even quite complex studies requiring quite a lot of information to be taken from them, and blood sampling, etc.
It's to do with decreasing that gap in understanding and making sure that the consent process has taken place.
It's absolutely vital. It's completely vital, and that's really why it's one of the major reasons why it's important to involve patients in the design of trials at an early stage. It's particularly important that sort of patient-facing materials, so patient information sheets, for example, have been reviewed and by patients, so that they can tell us whether they want to know more, want to know less, whether something is put in a way that's easy or difficult to understand, and we can adjust them accordingly. So it's really important that happens. Once a trial's ongoing, really, a lot of the role of kind of keeping the patients informed falls to the trial coordinators and the research nurses, and that's often patients who are participating often see that as a major benefit of participating in a study. It's that constant contact with quite experienced healthcare professionals in their area, and we often are able to find. We're often able to optimise patients' treatments in other areas not related to necessarily the trial, to make sure that they're getting absolutely the best care when patients are in the study. And I think some patients at least see that as a major benefit of being involved in clinical trials.
Well, for sure, when, in my position in the laboratory, we do keep a really close eye on all of those samples, even if it's not a visit day or research sample. It's those just a little bit extra care with that. It's hard, like you said, sometimes there's a lot of time points and there's a lot of bloods that need to be taken, so it's vital that everything is processed really to a high standard. So
it's the protocols are often quite strict, and we have to do things exactly as they're written down, because this is research. It's not standard of care, and so we do things as the protocol says, because that's what the patients have signed up for, and that's really important.
Exactly. And for the to standardise the results as well for whoever's conducting those trials. We obviously undergo site induction visits and monitoring visits. But how does the feasibility assessment take place in your environment? I know from the lab perspective, we always checking equipment and sending off logs and accreditation. So how does that come about for you?
Feasibility for me, that means do we have the patients, do we have the expertise to perform the trial?
So it comes under a recruitment side as well, if you have the people.
So that in broad terms. So if the study is can you recruit patients with heart transplant, I would look at that study and think that's not really feasible for us to do, because we're not a transplant centre. That's performed up in the Freeman. So we look to study patients in whom we have a huge amount of expertise. And so I look at the different domains of cardiology and cardiovascular medicine that we are active in clinically, and then I look for studies that fulfil that, what we do, so that it fits in with what we do clinically. Anyway, I hope that's what you meant. So, for example, we do a lot of studies in patients who have heart attack, for example. We treat literally, hundreds and thousands of patients a year with heart attack.
And that's something that I did want to lead on to, because operating like that really does make the research tailored to the local area and what's the outcomes that are going to be most useful for the local environment. And I think that's something that's really important when like considering it study involvement and like participation. Especially seeing as the network's building, we're getting a little bit more excited about collaboration. So for patients, they need to be able to feel the benefits of the research that we're doing.
Yeah, absolutely.
And just to end our discussion, would you have any advice for people who are working in a hospital environment who are thinking about getting involved with research? How should they go about it? What would be a good route to explore?
Okay, so that's a very good question. I think anyone who's working in a healthcare environment, nursing, allied health professionals, in the labs, pharmacy, whatever it is, they can participate in research, or they can be involved in research. And that can be simple. For example, knowing what clinical trials are going on in your area. Handing out patient information sheets to patients who may be suitable for a study, and knowing what study that would be. So that would be kind of dipping your toe in the water, as it were.
Exactly.
There'll be then people who are more involved in research, perhaps as a major part of their role, as in your case. You could be part of the main biochemistry department, but have a significant role in running clinical trials. The same is true in the pharmacy department, for example, is another area. We do studies in the imaging departments as well, so radiology, echocardiography, for example. People have their day jobs, but they also participate in the delivery of clinical research. Stepping up from that, you can be a full-time in research, and there's a number of research positions within cardiovascular medicine and surgery in this hospital. We have a number of research nurses, clinical trial coordinators, for example, and then you can run your own research, you can write your own research. So there's everything from dipping your toe in the water up to conducting and running your own clinical trials. There's something to get involved in, and I think for me it enhances my experience of my job. Okay, and that's the bottom line, really. I feel like it enhances my day-to-day interest in my work, and I know what's coming next.
Keeps you motivated when you've got that in a...
Absolutely. And I think knowing that you're always part of the small bit of progress in medicine, playing a role is highly motivating, and it's quite a kind of hopeful thing to be involved in.
Exactly. It sounds like it doesn't impinge on your workload. It almost ignites it.
Enhances it.
Yeah, great.
Absolutely.
Oh, great. Well, thank you very much.
Okay, thank you for having me.
Thank you very much for listening. If you would like to engage with us about any of the content, please feel free to use the contacts listed here.